sitting under the pictures here, so hopefully we've passed the first test to get going, right? Well, thanks everybody for coming to join here. Good to see a bunch of familiar faces out in the audience. And again, as JC mentioned here, we started these series of meetups earlier this year, really just with the mission to help continue to support making Atlanta the premier place to start and grow a health IT business. We just feel there are so many great resources and opportunities in Atlanta, and the more we can do to try and connect folks together there, the better. So today, what we got is an investor panel of several folks, Atlanta area healthcare investors, and we're just gonna talk a little bit about their background story, what they look for in healthcare companies to invest, lessons learned, and then close with a few things on future of healthcare and what it takes for Atlanta to continue to grow. So I will just get started with a softball question here for everybody, just starting with just your name and why you got into healthcare.
My name's Sarath, Degala. I'm with BIP Capital. I got into healthcare over 20 years ago now. I had a professor in college who was a CEO of Orlando Regional, and he asked me why I was going into pre-med, and I said, because my parents told me to. And he said, why don't you come look at hospital administration? So 20 years ago, a guy gave me a shot. I started out as an ER patient greeter, welcoming people into the ER at a level 1 trauma center, and over 17 years worked my way through becoming a CEO of a hospital, running several large health systems, doing strategy and M&A, and I always thought I wanted to affect large change in healthcare. I wanted to originally become a doctor to do it, and realized I could affect more people in a broader way as an administrator and operator. So after 17 years of doing that, joined BIP about 2 years ago, looking at healthcare technology and innovation. I felt like the last 7 years of my career at Ascension and Tenet, spent a lot of time doing innovative things, taking smaller companies, piloting them in certain markets, A/B testing them against other potential vendors, and then helping bring those across the system. So I thought, wow, with that experience, I could come do that on the venture side, and that's what I've been doing the last couple of years.
Great, Spence? Good deal. So good morning again, everyone. Spence McClelland. So I was also pre-med at one point, and then after being an EKG technician for a couple of years while being pre-med, realized I did not want to be a physician, so switched over to the business world. But I was with some later stage, larger investment firms for a couple of years, and then after business school, went to work for a healthcare business up in Nashville called Healthways, which was a big kind of payer services company selling into health plans and large self-insured employers for wellness and disease management programs. Ironically, now owned, most of those assets are now owned by Sharecare right up the street here, but that's a long story. But I was there for about 5 years before coming back to the investment side. I've been at Noro-Moseley now for about 10 years here in town. And pretty similar strategy. These guys, we call it early growth equity, so we're focused on companies anywhere from maybe 2 million up to 10 million of revenue. And we're usually investing somewhere between 5 to 10 million ourselves in those companies to invest in sales and marketing and new products, things like that. We've got a blend of strategic investors and financial investors in our funds. We've got some health plans and hospitals that are investors in Noro-Moseley. But as many of you guys know, we also have some folks in the firm who do things like internet security and sales and marketing software. So we're not 100% healthcare, but healthcare is about half of our practice. So.
So Philip Lewis, I'm with Fulcrum Equity Partners. Was not pre-med, blood makes me queasy, so never thought I'd get into that. Frankly, got into kind of the healthcare world about 12 years ago by accident. I was working in investment banking right before the downturn and got laid off like a lot of investment bankers, and was looking for my next gig and got connected to Fulcrum when they were starting. So it was the 3 founders, and then I joined them. And honestly didn't know the difference between Medicare and Medicaid when I joined, but kind of got up to speed pretty quickly. And have been there 12 years. I took a 2-year detour back in 2014, 2015 to go be CFO of a health IT company focused around employee engagement and wellness. And I've helped grow that company and merged it with another business. Actually still on the board of that one today. And where we invest is not too dissimilar to Spence. 2 to 10 million fast growing companies. We will do more services. So we'll do the HealthIT, SaaS stuff. We'll also do home health, hospice, ER staffing, true services that don't know what ARR or a CAC is. So we kind of do both worlds.
Great, thanks guys. So just to go a little bit more into the firm and the focus, you mentioned doing healthcare, but also other things. What is it about healthcare that your firm finds exciting as an industry to invest in?
All right, I'm holding the microphone. I'll start off. Well, yeah, we've actually, Noro-Moseley, that is, has been investing in healthcare since the start of the firm, and we used to do a lot more. I was talking to someone earlier, medical devices out of Emory, and drug development deals, HealthIT, services. We've really kind of tightened our focus, I'd say, last couple of funds into more just software and some tech-enabled services. And look, I mean, it's nothing no one else here doesn't already know. I mean, it's a huge part of the GDP. There's a ton of innovation going on right now. It's something that we all intrinsically care about and have personal interactions with. And there have been some great returns in the industry. So I mean, there's a lot of good reasons to be focused in healthcare. It's not without its challenges and pitfalls, which I'm sure we'll get into. But the firm's had success investing there. And I think when I joined about 10 years ago, the guys who were running the firm at the time looked and said, hey, where have we had success? Where do we think there's going to be opportunities? Healthcare IT was one of those spots.
Yeah, and really, kind of the genesis of Fulcrum, we're all former operators. That's why I took that 2-year detour. My 3 partners, Tom Greer, actually ran his own hospice, Regency Hospice. She sold, it's now part of Curo. Jeff Muir, another one of our founders, he's run a couple of different healthcare companies, T-Squared Medical, which merged with Matrix back when Matrix was going public in the mid-90s, another PPM company. He was the original investor in Healthfield, which became Gentiva, which is now part of Kindred, which is part of Humana, or that whole role. So really, we invest where we've operated. That's where we think we can add the most value. And investing in healthcare is all about the operator. Things are going to change. CMS is going to, increase reimbursement, decrease reimbursement. They're going to say, this is a value, this is a bundle, and that's going to change over time. But a good operator can always kind of manage through that. So we're really investing as much into the operators that can manage through those swings.
Yeah, I think BIP's been investing in healthcare for about 10 years. The 2 big exits from them are Ingenious Med and VendorMate. I think now the reason why healthcare is such an increased focus is that's my background. So I'm running the healthcare vertical, and we have over 50% of our capital in Fund 4 allocated to healthcare. That's very similar to Philip and Spence. That's kind of where I've operated. That's what I know. And there's a lot of innovation that can solve problems in healthcare today, and the healthcare environment of providers is really focused on cost containment. A lot of the focus from the payer conversations is around how do we improve cost, quality, and outcome. And it doesn't take large leaps or large amounts of innovation to improve those. It's about trying to do that and limiting the amount of variation in kind of physician behavior, or not having them do anything additional or extra, but still having a good outcome from a cost perspective to gain real traction. And we feel like with our connections in healthcare, we can get a lot of companies from a kind of early growth stage to a later traction stage pretty quickly with our ability to make some connections into those health systems and help drive innovative change.
So you mentioned, Sarah, sort of innovation and different areas within healthcare. And as we know, healthcare is very broad between payers and providers, life sciences, med device, SaaS, right? So maybe just for a couple minutes, let's talk about an area you guys see in healthcare, whether it's a space or a technology or an opportunity that you think is growing in a good future for entrepreneurs to go after, and why.
I'm gonna steal the easy one here, guys. The data analytics space is really interesting. It's been obviously an area of focus for a lot of funds, not just here, but on the West Coast and the Northeast as well. Just see what you can do with predictive analytics, taking genomic data, taking pathology data, taking different genetic markers, data from the EMR, and what you can start predicting around a certain type of, you want to go into precision medicine, we could go there, but it's around what's the right treatment for Sarath Degala versus what's the right treatment for Spence. We could both be coming in for the exact same thing, but the treatment, the therapy, the diagnostic and the drug treatments could be totally different. So I think that's a space that providers and clinicians are clamoring towards, of saying, how can I be more efficient? How can I drive better cost savings? And all the payers are saying, why do I want to waste a year's worth of drug treatment on a drug that's not going to work for Sarath, but that drug works for Spence, it works for Phil, but doesn't work for me. So what's the right therapy for us? We feel like there's a big opportunity in that space. It's not, at first we all saw this in oncology about 5-6 years ago. That's moving on from just oncology into other therapeutic spaces. We focus on tech and IT in healthcare, a little bit of tech-enabled services, but on the data analytics side, there's companies popping up all over the place that are trying to figure out how to monetize that data. And now with de-identified, taking all this clinical data and outcomes data and quality data, and now you de-identify it, and now payers and pharma companies and med device companies all are clamoring for that information. That helps entrepreneurs who have that information monetize that and exit.
Yeah, I'd kind of add to that. I think that's really, if you're talking really long tail, I think that's where the kind of future of healthcare. I think right now you're seeing a lot of hospitals very focused on reducing readmissions. I mean, that's a huge area we're focused on. You're also seeing the new kind of payment mechanisms out there, the whole value care, the bundled payment. You're seeing a lot of the hospitals and health systems trying to figure out how to manage that, how to, should we acquire more groups and bring them in-house? Should we look at, outsourcing that and just managing the whole patient life cycle? So those are a couple of the areas sort of in kind of the sort of new ways of looking at revenue cycle management, and then sort of the whole, patient management around readmission.
No, I absolutely agree with both of those. And, one thing investment we just made, actually, an area we spend a lot of time in, is this whole social determinants of health space. And you read about it every day, and no one really knows exactly what it is. But a lot of the challenges for people to even address their clinical health issues are things like access to healthy food, or access to shelter, or having a job, and mental health, and all those issues. So how can traditional medical players, hospitals, payers, employers, for better or worse, help individuals address those challenges? And this investment we just made down in Austin, Aunt Bertha, is in that space, one part of it. But I do think, and these things all bleed over, right? I think using analytics to identify people who are at risk for social determinants of health and drive those interventions, and some of the areas that Philip was mentioning, it all ties together. So, but I think that's a huge new area of focus. I hope it isn't just a fad, that people actually start to invest and figure out how to make that work.
Oh, very cool. So, a couple areas of interest there. One thing that I hear from entrepreneurs, whatever the area they start to focus on to get going, is, where do I start? How do I navigate healthcare? Because you've got so many different constituents that have to be involved, many times more complex than a traditional business. How do you think about advising somebody who's starting a company? What order, or how to sort of bring all of those stakeholders together?
I'll start. I think the first thing to do is do a ton of patient and client discovery. So every health system puts the patient first. So whether you're sitting down with a clinician or with a group of patients, you figure out what their problem areas are, and then you've got to spend a lot of time making sure that problem area is the same for constituents in multiple markets. With physicians, it can be something as simple as, how do I add one more patient visit to my schedule a day? How do I reduce the amount of cancellations a day? That hits their bottom line, it hits their pocket, hits health systems' pockets. Or how do I make my job more efficient? And then making sure that efficiency is the same for every physician. And then tying that back, you've got to be able to tie this back to an ROI. So ultimately, it's great to have a bunch of patients agree on a certain potential system or technology you're building, or a physician or a group of physicians, but if it doesn't tie back to an ROI that the CFO ultimately can sign off on to say, yeah, let's pilot this somewhere, it's really hard. So if you're trying to start a company, I would really start with just taking a small problem. I mean, there's so many big macro problems out there. Take something small. How do I add one incremental visit, one incremental surgery, something that's monetary that ties back to the clinician, that's going to drive their innate want to help support it and want to pilot it. So I would start there.
Also, make sure you really understand who the ultimate buyer is. If you're selling into a hospital system, for example, make sure that this problem that you're solving is big enough to actually get sign off on. We have one company in our portfolio, not gonna name which one, but it's a great solution. It solves a problem, but when they go to try to sell it, it's not a big enough problem, and the existing solution works well enough where the hospital CFO says, that's great, but why am I gonna change all of these processes to this little better solution, but this is not broken and that's not a problem, so I'm not gonna go try to fix it. So really make sure that you understand this is a broken issue, this is a problem that needs to be fixed, and it's a big enough problem to actually get sign off on. That's for a hospital. If you're selling to a physician or a doctor group, then yes, that one more visit, that one more patient, that one more efficiency, that's money to his or her bottom line. So that, just really understand who the ultimate buyer is for whatever product or service you're trying to sell.
Those were good answers. I have nothing to add.
So a lot of good stuff on customer discovery, right? I think that's something that we see across all industries, really making sure you're understanding the problem and the solution and the buyer there. Another thing I hear from entrepreneurs in healthcare is, right, I may have done some of that, but now I can't even get in to have conversations. It's not like a B2B SaaS play where you can sometimes just cold call and start dialing or get somebody to sign up online for free. What's some advice or lessons learned you guys see of how to break into a health system or a payer or one of the larger organizations?
I didn't answer the last one, so I guess I got to start. Well, I will say, and this is something that we spend a lot of time looking at on the front end of investments, and then we should be helping with during an investment, but it's partnerships. I think healthcare, not unlike, but maybe more than a lot of other industries, you've really got to figure out the partnership strategy, and it can be a sales channel strategy, or it can frankly just be a indirect kind of strategic relationship. But it's so hard to penetrate these hospitals and payers for a variety of reasons. They're big, they're bureaucracies, they're understandably protective of patients and patient care and physicians, and but given that, how do you overcome those sales cycles? And to the extent you can work with other groups who've already crack that nut, who've already established the trust channel with the provider or the payer or the pharma, whatever it is, the better. And as I said earlier, these problems all bleed into each other. So the odds are, if you really put your head to it, you can identify 7, 8, 9 companies out there who are related to the area you're focused on, who are probably thinking about the problem you're working on and may not have solved it yet. So there's always this tendency to protect, this is my baby and I don't want to tell the world about it. Someone's probably thought about it. Go to those companies and talk to them about what they're doing, how can you help them, and we always encourage companies to go do that sooner than later.
Yeah, we've seen a couple of companies for their first clients give it to that client for free and put whoever the buyer is on your advisory board, stealing that from Sarath earlier when we were talking before this, and give them a little bit of equity in the company. Why are they going to take a bet on a pre-revenue company? So really work with that first client and say, I got to generate revenue from X hospital or system or X physician group to say, hey, I think this will work, let's develop this together. We're going to use you, and hey, we're going to put you on our advisory board and give you a little bit of equity in the business.
I think the industry's changed a lot over the last five years in particular. About a lot of health systems have now started their own venture or innovation fund and innovation group. So just off the top of my head, I know Innova has, Centura has, Intermountain has, CHI has their own group. So you've got a bunch of now large health systems that didn't have a fund before. They now have a fund. So now I think it might even be easier if you reach out to those innovation people who are just focused on innovative ideas, innovative startup companies that they can take and do exactly what Phil said is they'll take an early piece, they'll pay nothing for the initial launch of a pilot or platform, and they'll take warrants or a piece of equity in the company as the company grows and scales within it. HCA had a very interesting example 2 years ago. They took a company who does payments processing. So every single credit card transaction that was going through HCA, which is the largest public hospital company out there, they realized, they went through a vendor analysis and said, wow, we're paying X hundreds of millions of dollars to this payments company for every transaction that gets processed at our hospitals. They found a local startup in Nashville. They bought 75% of the ownership of it. And then 2 years later, this company's doing well over $300 million in revenue, all through HCA. Not a bad start, right, as a client. So now they've taken that, now they're doing payments processing for other people. So these companies are starting, these hospital systems and health systems and payers and med device companies are all, like Stryker has their own fund. Da Vinci has their own fund. So you've got people now, if you're doing med device, if you're doing stuff in the payer space, Kaiser's got a fund, Blue Cross has a fund, that you can start taking these smaller companies and getting some initial venture bets from people who 10 years ago would have said, give it to me free, we'll try to pilot it if you know the right people, you've got to put someone on an advisory board. Now I think there's a few more creative ways to do it.
So to that point, Sarath, it seems like every day there's another new innovation fund, innovation group, et cetera, popping up at a health system, a payer, or an industry player. What do you guys see as sort of what's going to make those successful or not, and sort of how will those play out going forward?
If they make good investments, I don't know if they're going to be. I think a lot of corporate VCs have not been successful, frankly. I know we've been saying all the positive stuff or whatever. A lot of them are taking very early bets on technologies that may or may not work. So I think there's been a struggle for them to actually work. They can get you some initial client base, but you got to really understand what the end game is. I mean, we're looking at one thing with Optum Ventures right now. So we like the idea of that because they could provide some scale and volume, but how much can they really help on the business side? Or are they just trying to be kind of an innovation factory for a lot of different things? So I don't know. I'm always a little skeptical of getting an actual one of their funds to invest in you. You got to be careful about how much information you're providing them. We're actually in a data analytics company right now that sells a lot against the old advisory board, which is now owned by Optum, and healthcare systems don't want all of their healthcare data flowing through Optum anymore. So I'd caution a little bit on that one, but hopefully I'm wrong, and hopefully they all make a lot of money from it.
So looking at, you guys see lots of businesses every day and have invested in a lot. Let's spend a couple of minutes going through some of the lessons learned from some of that. So maybe starting with, as you're looking across businesses, what are some commonalities you see in successful healthcare businesses and things you look for to invest?
Go ahead.
Man, if I knew that one, I wouldn't be sitting here this morning. I think it's some commonalities that across successful companies. I think humble management teams. I mean, healthcare is a tough space that's going to beat you up and beat you up and beat you up. It's going to be a 9-12-month sales cycle. They're going to say they're going to buy from you, and then you're going to get stuck in procurement, stuck in legal, and then you're, IT review, and then your champion is going to end up getting promoted into a different division. So, what you found successful are ones that really understand how to navigate a healthcare sale. If you're selling to a doctor group, you realize that there's 10 decision makers that have 15 different agendas and 30 different personalities across those 15 people. So really understanding how to map out the decision makers, really understanding who the real influencers are, having champions across different levels. So you have the administrator, the physician, the user, all having multiple touch points into what you're trying to sell. So you're really sticky within it. Would be some of the advice I have very thick skin when you're selling to doctors.
Yeah, no, it's all absolutely true, and kind of ties up. So a couple of things. One, it's not unique to healthcare companies, but don't run out of cash. Just it's going to take 5 times longer in healthcare. So that's obviously a big thing you see. Sarah said this earlier, but the ones that are most successful are the ones that figure out pretty early on the ROI and can very clearly articulate that. So these people in all these different committees you go sell to inside the hospitals and payers, that's always what they throw out. I don't even know if they know what it means half the time. They're like, oh, what's the ROI? I can't see the ROI here. And so you have to be very clear about this is the exact ROI, whether it's administrative savings or enhanced revenue or decreased people that can have to process this claim, whatever it is. Figure that out sooner than later. Talk to people to help you figure that out, and make sure that you're pressure testing that. And then what else would I say on that?
Well, let me ask a question on that, on the ROI, because that's something, again, across industries, but even more challenging in healthcare. How do you think about proving that? What are any tips or tricks of how to quantify it, how to prove it? You mentioned sort of the hard, revenue or cost savings, but also the administrative time or the patient satisfaction. How do you think about those different buckets of ROI?
I mean, we've seen it ties back to the comment on finding some of these partners who may invest in the company or you may do free pilots with. Just good old-fashioned upfront saying, we want your help measuring this. Here's what we're going to measure. Is it hours spent on this? Is it decrease medical claims costs, whatever it is, so that everyone up front knows we're going to be measuring this, we need your help doing it, and that they sign off on it, right? A lot of the times on these value-based deals, it's all these, oh yeah, shared savings. We've had health plans with early stage companies say, yeah, well, we're going to be 50% of what you save, so we'll give you this small administrative fee now, we'll make it up on the back end. You do the math, they haven't really signed off on the math, and then they say, well, you didn't do that. We had 5 other programs that were helping people with diabetes last year, so we're not going to give you that $2 million that you say you're owed. So, I mean,
I've made that mistake before.
that happens, and that hurts, right? So just upfront, finding the customers or the partners that are going to be with you and helping you measure and very specifically figure out the math, I'd say.
I mean, I'd reiterate what Phil said around just the life cycle of the sale is so much longer in healthcare. And the successful people that navigate this are people who can kind of, one, not run out of cash, but two, you drive innovative ideas, partner with people outside of healthcare. So unfortunately, healthcare is like a decade or two behind other technology and SaaS companies. So what we found from successful entrepreneurs is you need someone with some type of healthcare knowledge, helps. It helps to have some people outside of healthcare that look at the world differently to challenge those typical healthcare norms. But then you also need to make sure that the company isn't based on a lot of fluctuations in reimbursement. So, I mean, a lot of companies now that are potentially driving their business off of commercial claims or just Medicare claims only, or based on whoever's elected, you could have a lot of fluctuation in reimbursement that changes the way you look at your company and the company's financial. But from on an ROI, to your point about AT, about an ROI, we found it really difficult to sell into healthcare companies a soft ROI, like a touchy-feely patient satisfaction. Even though it drives a certain amount on your HCAHPS improvement, it's not enough of a pain point. Improving your HCAHPS by 4 points. When I was a CEO, I was measured on that, and I would have loved to increase my HCAHPS by 4%. But it's not, and it helps drive my bonus and my team's bonus, but doesn't do anything for the healthcare system. That's not as much of a savings or a financial driver. So as much as I love patient satisfaction companies and nurse rounding applications, and because that affects patient safety, unfortunately, it's hard to sell into, really hard. The CNO, which I think is a really tough job in a hospital, he or she unfortunately doesn't have the most buying power in a health system, so it's tough. Same thing with the chief medical officer. They're trying to help with clinical quality and limiting clinical variation to improve outcomes, and they too don't write a check. They have no check writing authority. So I think understanding who can write the check, who can make those decisions early on as you're building the company really helps. Hard ROIs are easier to sell, and ROIs from different stakeholders are easy. Both Phil and Spence did a great job of saying, those free pilots. I think free pilots is a great way to go. You figure out what you can measure, what the hard cost ROI is, whether it is an FTE savings, because you've now seen you needed 11 people to do this job before, and now you need 7. It's pretty easy to do the math on those 4 additional FTEs. But you also be sensitive to the fact if you're only coming in from an FTE reduction perspective, organizations, unless they're very, very top line driven, they're going to have a hard time saying, Susie, who's been here for 25 years, and Johnny, who's been here for 30 years, you guys got to go. Making those firing decisions, as much as we would like to say, yeah, fire that person, it's hard to do. So if your solution is only affecting that one side of the equation, again, that's a little bit of a tougher sell. If it's a growth or revenue generator or time and efficiency gainer where you can add something, and whether it's one more OR case or you're doing cost savings with a payer that you can actually use attribution and say, we drove this amount, I think it's really tough to sell into. And I think that's a really hard place to scale a company if you can't have that.
Yeah, and I'd add, if you're looking at an actual FTE reduction play, one thing, part of your process, you have to remember, sometimes those FTEs that you would be reducing might be part of the decision process to hire you. That's part of the rev cycle company. And one thing they learned actually is try to think of ways that rather than you reduce them, to repurpose them. So you actually learn, okay, so what could they do if they are not just handling claims processing, data entry, et cetera, that can be done by bots. Like, okay, now they can be focused on account management, or we'll hire them and we'll actually use them to focus on old AR. So now rather than you sending it out to this collection agency that you're paying 25, 50% to, we'll actually employ them and we'll use that delta there to pay them. So really think through maybe repurposing and have that as part of your sales pitch. So you're not just going in there saying, hey, Sally, who's been with you for 30 years, is going to be out of a job. That's tough.
I finally remember what I was going to say. It's kind of what Sarath was saying. Iterate on your business model too, right? So we had one company that was trying to price, it's just X per bed to the hospitals, and then trying to calculate an ROI. Well, you're saving this much per patient. It was kind of a pharmacy application, and it was really hard to show that every person in the hospital was getting some level of savings and some reduced nurse time spent doing medication checks, things like that. But then when we realized, well, if you just, for the exact same dollars, by the way, position it as, it's this % of your wasted drugs, wasted inventory in your hospital. And all of a sudden, the people said, the CFO at the hospital, who ultimately makes a lot of decisions, was like, well, wait a minute, no, that makes a lot of sense. So if you're just saving this much in wasted drugs that we're throwing out of our drug cabinets, then yeah, that's like a 5 times right. Yeah, but it's this exact same contract, exact same price. So you just got to think and iterate on what exactly are we doing, what's the impact we're having, how do you, some of it's just art over science, how do you position this to break that seal?
That's a great point. So getting close on time here, a couple more questions to wrap up and then we'll do some Q&A, but 2 more questions here. Again, you see lots of folks coming to try and raise money or pitch their business. What are some tips or advice you could give for people to make them be most prepared before they would go speak to a potential investor?
Yeah, well, I guess prepare. First of all, make sure you understand who your buyer is. Make sure you have a really true understanding of the market you're selling into. Don't think that you know everything, though. A lot of times when you come and pitch us, we're going to give you advice during the pitch, and we'll have heard the business for roughly 30 minutes. So you might be like, why is this person who's only known my business for 30 minutes telling me about it? But a lot of times we've heard similar things, so we're trying to say, have you thought about things this way, and have you thought about things that way? And keeping an open mind, because you got to remember, you hear this at a lot of panels from VC folks, but when you take money from us, it's a 3, 5, 7, 10-year relationship. It's actually harder to get out of than a marriage. So you are stuck with us. So you want to be somebody who feels coachable, who has that similar personality set to you. That's somebody you want to work with. So when you go in there and you try to be, I know everything, da 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 da. Do you want to work with that person? Maybe not. But that's kind of the way we look at it. Is one of the first things we're doing is just really go in there with a humble mentality, and hopefully the VC you're talking to also has a similar mentality as somebody you want to work with.
Yeah, absolutely agree. The other thing I'd say, just more of a personal thing, is I love early on seeing that people are using this and they like it. And again, it's not unique to healthcare, but especially in healthcare, given all the challenges to physician adoption and patient trust, all that. That's that initial check that, hey, we haven't just built something that's going to address a big problem in a big market. We've got a good team. People are actually, the dogs are eating the dog food or the Kool-Aid or whatever the analogy is. Dogs, Kool-Aid, I don't know. But the point is,
it's early.
It's in the market. People are using it. And maybe even it could be free, but people are using it and they like it. It's just so hard to get people to use stuff in healthcare.
Yeah, the only thing I'd add to that is really that really entrepreneur focused, and I think all of us are, is really making sure you have the right complement of the team built around you. We found every company that's been successful, it's not just one leader who's kind of driving the ship. You've got a really solid team who kind of complements their strengths and weaknesses. I think everyone here knows that, but I can't tell you how many times we see a team that's really is one person, and there's a big drop off between the founder, CEO, and then like the next level. So I think really being cognizant is as you come in to raise money, the team is as important as kind of the business, because we're investing in a team for 10 years, 7 years. And we want to make sure we're comfortable with kind of who you have around the table and kind of how you as a team collaborate and make decisions. Because as we're giving you feedback during your pitch, we're going to see how you guys are communicating. If it's the same person that's doing all the talking and acting like the subject matter expert, we know pretty much that that person's kind of dominating the think within the organization, that's not always a great thing. So I think that's one interpersonal kind of dynamic to take a look at. But they've all said you're looking at companies who have some traction, you're looking for companies who have paid or unpaid customers. We'll go a lot more into kind of customer discovery. We'll actually, and all of us do this, but talk to customers. We'll go visit and see the technology at play, how it works, getting feedback. So before you send over some references of who's using it, I would tell you to send your account management team or you to go out there and walk a couple days in their shoes to make sure the client doesn't have any issues using it before we call them and they tell us the stuff that's they don't like about it. So it's again amazing how many times that happens too.
Cool. Last question, then we'll open up the audience for Q&A. We mentioned at the beginning, part of the mission of us doing this is to try and continue to promote Atlanta for HealthIT. Any thoughts on what Atlanta can do better to continue to be a place for HealthIT?
Yeah, I mean, in a dream scenario, and I think this is what we're trying to build here, is really have an ecosystem of healthcare providers, payers, and hospital partners that all collaborate together to help further. I mean, we have a ton of great entrepreneurs here who can take an idea, build something, and find a solution to that. We have great tech developers here. We have great entrepreneurs, but what we're missing is really physician and payer partners to kind of solve those problems. So I think the more collaboration we can get from the local payers and the local providers, the health systems of the world, to start sharing some of their problems, because to your point earlier, Spence, every single healthcare providers, whether you're Piedmont, guess what, Wellstar has the same problem, Grady's got the same problem, Northside, and so does every other hospital system in the country. So I wish if they were a little bit more open to kind of what those problems are, then letting us kind of go solve them. I think if we can create an environment where that's open and it's not competitive, and we're trying to solve that for everyone, I think that's kind of the direction we need to go. And entrepreneurs having a data sharing room to actually test against patient claims. So everyone here, if they're doing something that's going to interact with the healthcare space, is going to have to build some sort of interface with Cerner or Epic or Athena. So to have some kind of data lake where we can start, I don't want to say playing with de-identified data, but being able to build some technology out around that, I think would be very helpful for entrepreneurs here in town.
Yeah, the other thing I'd say is, don't think you just have to hire healthcare people or people with healthcare experience for your company as you scale. If you can find an A player or an A developer, hire him or her and bring her onto the team. Doesn't matter if she knows anything about healthcare. If she knows how to develop, that's what you're looking for. Like I said, 12 years ago, I honestly didn't know the difference between Medicare and Medicaid. I'd never had a need to know that. I was real estate, private equity, and investment banking in real estate. So never knew that. And now I can talk about value-based care, bundle payments, and all that good stuff. So find those A players. And the other thing is, don't be afraid to get in the car and drive up to Nashville or hop in a plane. It's $180 for a flight up there now that Southwest flies there. There's a lot of healthcare companies and healthcare talent there. And I'm not saying move your company to Nashville, I'm just saying it's really close and there's a whole lot of healthcare up there, so don't be afraid to go up there and search for companies, search for talent, search for customers. It's right up the road.
Recruit them to come down here in Atlanta.
Yeah. The only thing I'd add, because amen to what they were saying, is it'd be kind of cool, I think. I mean, 55 million or some people in the U.S. are on Medicaid now. And it's such a big area to spend for our state. I think it'd be kind of cool if our state or our city was viewed as a innovative, and I'm not saying they're not, but there's an opportunity to be viewed as an innovative state Medicaid payer. And just bringing in, if there's a company that's doing something innovative in Medicaid clinics or Medicaid outreach, that we're the ones they come to, and because they know we're gonna pilot it or we're gonna roll it out. I think that'd be kind of cool for the state of Georgia, but that's a whole other thing.
Well, great, well thanks guys. Let me turn it over to the audience now for a couple questions.
Sarah, nice to see you again. Spence, Philip, thanks for your comments. We've talked a lot about infusing innovation in health systems. My question is a different one. That innovation without the right talent in those organizations isn't going to go far. Are you seeing health systems invest in upskilling, reskilling, elevating the talent within those environments to actually not talk about health innovation theater, but actually implement some of these things?
you and I both know that's a loaded question. The politically correct response is, I think they're trying to upgrade the talent around them, but hospital systems are like old dinosaurs, right? So I think to your point, David, I think you're right, that the hospital systems have to think differently. They've got to hire differently. The mindset of those that are going to be leading hospitals in 10 years are not the same folks that have been leading them for the last 25 years. Value-based care is coming, whether we want it or not, and those the operators who are operating in a value-based world have to think very differently than those that are thinking in a fee-for-service world. So I think that's going to have to change to drive innovation and to drive, or else you're going to see hospitals closing left and right around the country, which is kind of what you're at risk for in a lot of these markets where it is an ACO, it is value-based care. And it's not in the South yet because we're so far behind, but in the Northeast you're starting to see that.
I love the conversation about the customer discovery. It's so critical, and so often with technology and software, it gets overlooked, funny enough. I'm curious, in the folks that you work with, to what degree do you pursue that customer discovery or help them pursue that customer discovery? Like, what does that look like?
Sure. Well, again, a lot of groups do this, but we do have some of these health plans and hospitals who are investors in the fund, and those are great places to go plug stuff in, right? So if we find an interesting business, that's one of the first places we'll turn is, hey, here's a company that's doing something innovative, sounds like they're solving a problem we've heard you guys talk about, give it a shot, let us know what you think. I mean, that's one way to do it. And then it was said earlier, but there are all these innovation funds and innovation centers that these different groups are starting. So I think it's a great time to be starting a company in healthcare IT, because that customer discovery piece is probably a lot easier now than it has ever been.
Yeah, I'd add to that too. I guess if you don't have any customers yet, it's a little bit harder. But one of the most important things we do is actually we call customers when we're in our diligence and talk to them. And we found almost no companies when we invest have a customer advisory board. So that would be one of the first things you should do with your first couple of customers. Make a customer advisory board. You'd be shocked about how much they will tell you about what they want if you just ask them and start talking to them and get them talking to each other about, hey, I'm using this. Oh, I didn't know how to use that. We can use that. I mean, we were on one customer call with a company, customer of a company earlier, and they were talking about this big problem they had. And we we're just like, they do that. They're like, huh? They offer that? I'm like, yeah. So if you just create that, if you don't have any customers, go find 3 that would be potential customers and get them in a room. It's not like a focus group to say, hey, is this your problem? How would you use this? Do you use one of our competitive solutions? Figure out, go to your competitors' websites, see who their customers are, call them and ask them how they're doing it. You would be surprised how much they will tell you and how much they will talk if you just ask.
Yeah. One more thing is I do a lot around competitor landscape, really understand your competitive landscape, and do what Phil said is we'll do the same thing. We'll call, and whether you're coming in to solve this problem, we'll call 10 other companies that are solving that problem and go through the entire same sales process to understand what's really different about yours versus the others. And we provide that information analysis back to kind of our portfolio or the prospective portfolio company, make sure they understand, hey, this is really what the problem you're solving. Others are solving it in this way, saying this way. How is yours really different? If yours is different, let's make sure the potential customers understand the differentiation. And then with that differentiation, how much value is that driving for you? Phil had a great point earlier on of saying, yeah, it's a pain point, but this solution's a little bit better. How much better is it? And is it worth crippling and unhooking all these other systems that are tied to it?
Hi, so I specialize in the private practice and physicians group space, and you guys talked about the hospitals a lot. How close are the pain points between the two, and also where do you see the future of private practices going? Because a lot of hospitals are swallowing up these smaller groups. So that's the question.
Yeah, I think it ebbs, and I'll answer that in a reverse order for you. I think the ebb and flow of physician employment versus kind of non-employment and kind of going back and being independent practitioners. If you look at the last 40 years, it's kind of gone in tranches where everyone was employed and everyone was independent, and now the trend is everyone's employed. I think in the new value-based model, I don't think the employed will necessarily financially work in the same way that it is today in the fee-for-service world. So I think you're going to see a lot more creative companies like a Privia Health, like Iora Health, that are doing JVs with physicians that are, so it's non-capital intensive, but they're really JVing around cost, quality outcomes, and shared savings from a value-based perspective. So I think the worlds of hospitals and physician groups will always be intertwined. So the challenges of both are similar. So your question around how you innovate with them, I think actually innovating with a physician group is actually a little bit easier in a way, because they actually can make the decision, an independent physician group versus an employed physician group. And even if you get the 15 or 30 or 100 doctors to agree with the president or CEO of the medical group, say, we want to do this, if they don't have, a lot of health systems don't give them the purse strings to make that decision, so they'll just run through all the hospital people. That sales cycle is just a long, long time. But I think your point's correct of the independent world is going to ebb and flow. I think it's going to go back to more of an independent in years to come.
Yeah, the only thing I'd add to that is you are seeing, doctors historically are really bad business people. It's a 80-20 rule. But, you are seeing more and more of them starting to realize how much money they're leaving on the table. So the more you can go to a doctor and say, hey, look, if you were just to change these 2 or 3 things, you can make an extra $150,000. Like, huh? And you can really show that to them. You're starting to see doctors starting to clue into the whole new world of reimbursement, how payments work, physician scoring, making sure they're getting their full piece of the bundle. So the more you can help educate them, because they're starting to realize it, and they're starting to see that there are fewer dollars, doctors, they're being squeezed, margins are being squeezed, they're having to see more patients to make the same amount of money. So, if you're selling to doctors, really showing them that extra bottom line dollar is how you're going to differentiate. If it's just more soft things or whatever, they're like, all right, I got people to do that. But we found they're very coin operated.
Yeah, so I think you're in the most exciting place in healthcare. So I've got about 20 years till I'm in Medicare, and I don't want to have to go to a hospital when I'm on Medicare. So I want to go to physician practices. I want as much done in the practices and in the home as can be done. I only want to go to, all due respect to the massive facility Piedmont just built, I don't want to go there unless I'm having a heart transplant, right? So I think that's where a lot of the innovation is happening, is in the private practices and the retail settings and the ambulatory settings. In terms of the problems, there's similar problems, payments and rev cycle and patient engagement and all that, but I think there's a ton more opportunity because you're not necessarily burdened with some of the infrastructure and politics maybe of a large health system if you're independent, which is a good point you made. So if I was starting a healthcare IT company, that is exactly where I'd be focused. If I was starting a healthcare services company, some of the companies that Sarath mentioned, the One Medicals, the primary care, direct-to-employer models, I think that's awesome. So I know we're running out of time, but you're in a good spot.
Well, great. Thanks, guys. Just one last thing I want to wrap up. Couple upcoming Atlanta healthcare events up here. And the one thing I do want to highlight, you can't see behind Sarah's big head here, but reverse pitch program. Just one of the things we've been working on, getting feedback from folks over the past couple months, is the idea of connecting entrepreneurs with problems in the health systems. So I've been working with Sarath and Chris and Mike and some others, trying to design what that could look like, with the premise of you have a health system come and describe a real problem they have, present that to a group of entrepreneurs, vendors, investors, then have some period of time, 8 to 10 weeks, to go ask questions, research the problem, craft a potential solution, select a couple finalists, then go back and present to that hospital system where they would select one for a pilot to move forward. So we're still working through some of the details, but expect over the next month or so more to come from that, but we're excited about what we think that could be. So thanks again, everybody, for coming. We'll be around to answer questions, and have a good day.